Hey everyone, we are at AFC Urgent Care with Dr. Perm Singh, who is celebrating the World Tuberculosis Day, and Dr. Cam Parekh, who just made a beautiful presentation on tuberculosis.
So what is tuberculosis? Tuberculosis is a disease caused by a bacterium called as Mycobacterium tuberculosis. So it's a bacterial disease. What are the symptoms of disease? Cough that is lasting for more than 2 to 3 weeks, and fatigue, that is tiredness, loss of appetite, loss of hunger, weight loss, coughing up of blood, chest pain, fever, and night sweats.
Welcome to Yo India TV, and it was absolutely delightful to gather some more information on tuberculosis. And what I hear is that Alameda County is also impacted. So what's the best way to prevent?
The best way to prevent is to first get diagnosed of the neighbors that have the disease, so the disease does not spread. So we at our American Family Care Center are family practitioners, and we are able to help you get the tests done, get the diagnosis, and then get the treatment. This is a treatable disease, unlike cancer, which has no treatment or has difficult treatments. Tuberculosis is a completely easily treatable disease if you follow the medicines and take care of yourself.
So what happens if tuberculosis is diagnosed at a later stage? Like we hear for cancer, in advanced stages, it is still controllable, but at later stages, it becomes really fatal. So what's the trend, and how fast you think it can be diagnosed, especially if it is a latent one?
Tuberculosis can be diagnosed with a very simple test called quantiferon or the TB skin test. Early diagnosis, of course, helps early treatment and makes it easier. But in tuberculosis case, even if it is diagnosed late, it is still treatable. There may be complications to the bones, to the kidneys, to the liver from late diagnosis, but these are all reversible. So tuberculosis is always treatable.
In United States, California and Alameda County, we can see during 2018, 154 tuberculosis cases were reported to Alameda County, excluding the city of Berkeley. And the 2018 TB case rates in Alameda County was 10 cases per 100,000, so almost 10 cases out of 100. And there is a 24.2% increase from the 2017 rate. So the Department of Public Health, they released the data on 20th March about 2018 data. There is a 24.2% increase so there is a big need in our community. The 2018 rate ranks third among all, especially the Santa Clara County. So California has almost 5 cases per 100,000, and Alameda County has almost 10 cases per 100,000. And highest number is in San Francisco County, that is 13.2%.
Hey everyone, we are at Dr. Perm Singh's clinic for the World Tuberculosis Day that is celebrated every year on March 24th. This is a beautiful occasion because we are preventing one of the diseases that Alameda County is suffering from, and we just got some of the beautiful statistics from the presentation made by Dr. Cam Parekh. I have 2 dignitaries right here with me, Mr. Alan Nagy, who is the mayor of Newark, and Mr. Gary Singh, who is the vice mayor of Union City, the adjoining areas where Dr. Perm's clinic is situated, and we have a lot of patients in this area. And it's absolutely commendable to see the officials right here supporting this beautiful event. So tell us a little more about what's your take on the disease and about the spread and prevention that we just talked about.
Well, first I want to thank Dr. Cam and Dr. Har for having this event, because we were unaware that there's been such a significant increase in TB in this area, and certainly it's events like this that inform people that through knowledge there's power, and this provides the knowledge that we can do something about it. And so we look forward to working with the doctors to make sure that our residents get notified of the testing possibilities for them.
So what's your take on the proceedings of the event?
Well, first of all, I want to thank Dr. Cam and Dr. Perm Singh to getting out these words, because we do know there's a deadly disease, and especially in India, and it's spreading around, like Dr. Singh said, in Fremont and Alameda County. and we do need to take action. Means we need to spread the words out and let everybody know this disease needs to be cured, and the only way to do it to go out there and have a meet the city officials, churches, and everybody else to handle this properly. Until we do so, we cannot take care of this disease. It keeps spreading. So I really thank you, bottom of my heart, to doing all this for the community. There are not very many people out there to go out there and do such a thing, and it's very encouraging. Thank you.
Absolutely, and we are glad to know that in this area we have AFC Urgent Care, which is taking care of all the possibilities that potentially impact tuberculosis, including the test and everything. So, Alan, what's your message to the viewers on this occasion?
Well, the message is get tested. I think that's the important message of this whole event, is that, take the time to get tested.
Absolutely. And what's your take and what do you want to tell the viewers?
I just want to tell them, don't hesitate to go see the doctor. If you have a cough or you have a mucus coming out, please go see the doctor. It's very, very important to get tested.
Absolutely. Thank you very much.
So again, once again, these numbers are from place of birth, and we can see clearly people born in Philippines, 19.5% versus India, 16.2%, then Vietnam, then United States also 9.1%. How do we prevent TB? So get tested if you have any of the risk factors for TB, born in a country where TB is more common, or have a weakened immune system, or were in close contact with someone who was having active TB. Birth, travel or residence in a country with an elevated TB rate for at least 1 month. So if you travel especially to your home country, India, then and stayed there for more than a month, should be tested.
Awesome. So, Dr. Parikh, you mentioned in your presentation that whoever travels back from India and has stayed there for more than a month should come and get tested. So, why is it that the occurrence of this disease is supposed to be on a higher side in India and other Asian countries as compared to the US?
So again, the socio-economic factors are the biggest cause, and India has the bigger TB disease burden. So somebody's traveled to India for more than 4 weeks and is being exposed to a person who was having an active TB disease. When they come back, they should be tested. So for latent TB, sometimes they are getting the infection, but they are not getting any sign or symptoms for that. So at that time, when they come back, they should be tested for that. And that we call is latent TB infection, means the bacteria are sleeping in their body and they should be tested again.
So nowadays we see a lot of resistance towards antibiotics. Drug resistance is one of the recent things that we are seeing, and I know that treatment of tuberculosis cannot happen without going for antibiotics. So what's your take on this?
The take on this is simple, that the tuberculosis bacteria has been tested worldwide, and we are presented with treatment plans from the Center of Disease Control in the United States and similar organizations in different countries of the world, and very specific antibiotics are recommended. So we are able to overcome this resistance issue by following the guidelines that are done after research and are presented to the community.
Awesome. So, the bacteria bacillus, as Robert Koch mentioned, and because of which we are celebrating this day today, is instrumental in causing this disease. So, how much do you think is the BCG vaccine effective in making the prevention?
Well, BCG used to be given in the countries where TB was more prevalent, but BCG is not that much effective. So again, the rule of thumb is get tested, and even though if you have a latent TB infection, you should be treated. And there are nowadays very good newer combination of medicines that could be given, and we're very shorter treatment for latent TB infection, 3 months, 4 months treatment, and once you get the treatment, you're fine. And even though if you have an active TB disease, there are very newer combination of drugs that are very effective.
Awesome.
So how does the TB transmits? So most of the time we are sharing the airspace, we are sitting here, we are sharing the airspace. So it's an airborne infection. People with pulmonary TB disease, they exhale the TB bacilli, Mycobacterium tuberculosis, in droplet nuclei. So there are common myths. TB, is TB spread by shaking hands, touching? No, not at all. TB spread by sharing utensils, dishes? No. Is TB spread by sharing the food in the family? No. TB spreading by sharing towels or linens? No.
So what we understand is that it impacts lungs the most, which is the pulmonary tuberculosis, but it impacts other parts of the body as an extra pulmonary tuberculosis as well. So give us some insights into the varieties and if there is a difference in detecting and treating the same.
The test that we do for the diagnosis of tuberculosis is a universal test. It tests for the presence of the mycobacterium in your system, both through the skin test as well as the blood test. And so knowing whether there's a disease in the lungs or other organs of the body is not that important initially. Later on, once you become positive for the test, then we can run furthermore tests to diagnose whether it's in the lungs, for which we do chest x-rays, which are done in our office. And we can also run tests if there are other organs involved. The treatment of the bacteria, the antibiotics are still similar and same, and we follow the CDC guidelines to give you the package of the antibiotics that are recommended, and so that covers the whole treatment plan. The message here is the disease is treatable no matter what stage, no matter what organ, it is treatable.
That's great to know. And we always think that smoking impacts lungs the most, and similarly we hear about pneumonia, which is of a similar nature. So what would you advise to the viewers who think that HIV or smoking or other diseases like pneumonia are related and may make it even worse?
Right. So as I mentioned in my slideshow, a person who is infected with HIV is already on immunosuppressive drugs, and if somebody is on immunosuppressive drugs, there are more chances of getting the tuberculosis disease. And on top of that, if somebody is on the other drugs like corticosteroids and other drugs, they are more prone to get the disease. Somebody is already having a pneumonia or other lung disease, is definitely those are the other precipitating factors for the disease.
And nowadays we are also hearing about reverse zoonosis. So this is basically humans infecting the animals, elephants, rodents, birds and others. So I believe vets would also have a treatment for the same.
Absolutely. The veterinarians are able to treat this disease in the animals also. They follow similar guidelines.
What's your final message to the viewers on the occasion of World Tuberculosis Day?
The final message is still that please help us prevent tuberculosis spreading in the world. And you can help us by getting tested and spreading the word to people. And we are happy to share with you the signs and symptoms of this disease at any time. You're welcome to call our office or visit your primary care doctor and ask the same questions so that nobody goes undetected, so that the spread of the disease can be stopped.
Perfect. What's your message to the Yo India TV viewers?
Sure, thank you. So the bigger goal here is to educate our community about the disease, and the to-go message is get tested. If you feel like that you were exposed to a person or other signs symptoms, you should get tested. Our office, Dr. Singh's office, is providing skin test and the quantiferon test, and as a courtesy, he is also offering a discount also, whoever is coming and joining this program today. And he is helping to spread the word out in the community to eradicate tuberculosis in our community, especially in Alameda County. Thank you.
Thank you so much, Dr. Singh and Dr. Kam, for the beautiful conversation. It was really an eye-opening conversation, and I truly appreciate all the knowledge shared. And I hope you will benefit from the same. Thank you.
Hello, I'm Al Nagy, Mayor of the City of Newark, and you can watch me on Yo India TV.
Mayor Gary Singh, Vice Mayor of City of Union City. Watch me on Yo India TV.
I'm Dr. Param Singh. Watch me on Yo India TV.
My name is Dr. Kam, and you are watching me on Yo India TV. Jasleen, Khanuja.